Okay, we're going to talk about performing the MEND stroke exam on our patient. So the MEND has three basic sections to it. So mental status, cranial nerves, and then limbs. So first is the mental status. The first part of that is going to be just the patient's level of consciousness. That's your AVPU scale, whether they're spontaneously alert, whether they open their eyes to verbal stimuli or painful stimuli. So if they're not spontaneously alert, I would talk to them, yell at them, try to get them to open their eyes. If they don't do that, then I would apply some painful stimuli like trap pressure and see if they respond to that. If not, they're considered unresponsive. The next part is speech. So you're going to tell your patient, repeat after me, you can't teach an old dog new tricks.
You can't teach an old dog new tricks.
Okay, and you're just listening for slurring of that speech. The next thing you're going to do is ask them, how old are you?
26.
Okay, and what month is it?
July.
Okay, that is correct. And then the next thing is just, can they follow commands? So I want you to close your eyes and then open your eyes. Okay, so that concludes the mental status portion. We'll move on to the cranial nerves portion. The first part of that is facial droop. So we'll say, can you show me your teeth or smile? Yep, okay, so just looking for facial droop there. We're then gonna check their visual fields. So you're going to kind of get in front of them, tell them just to look at your nose and just keep your eyes focused on my nose and tell me how many fingers I'm holding up.
4.
Okay.
2.
Okay.
3. 1.
Okay, so you're just looking in 4 different quadrants. Can they identify how many fingers you're holding up while they're still looking straight ahead? And then lastly, for the cranial nerves, you're going to have them look at your finger and follow your finger all the way over to both sides. Make sure their eyes can track your finger. And then on the limb portion, first is motor. So we're going to have the patient close their eyes and hold their hands straight out in front of them, arms straight out in front of them like that. And you're going to count to 10 and you're looking for any arm drift. Okay, and you would count out loud to all the way to 10. Okay, that's good. You can put your arms down. And then I'll have you uncross your feet here and then lift this leg up and hold it there for a count of 5. Okay, same thing, you're looking for any drift, and then the other leg.
Shouldn't have done legs this morning.
Looking for any drift in that leg. Okay. So then the sensory portion, we'll have the patient close their eyes and just tell me which side I'm touching you on, your right or your left.
Right.
Okay.
Both.
Okay.
Left.
Okay, so just making sure they can feel on both sides, on the upper extremities, and then same thing on the lowers. Which side am I touching you on?
Both.
Okay.
Right. Left.
Okay, so that looks good. And then lastly, for the limbs is coordination. So I'm just going to hold my finger out in front of you, and then I want you to touch my finger with your finger and then touch your nose, and then just go back and forth from finger to nose. Okay, and they should be able to do that with both hands. So on the other side, with smooth motion. Okay, and then for the lower extremities, coordination there, you're going to have them take their heel and run it up and down their shin from their knee to their other foot, just like so, and that should also be a nice smooth motion on both sides. And that concludes the MEND stroke exam.